Which of the following is not a characteristics of the granuloma? Here are the options. Options are altered macrophage, fused macrophage, epithelioid cells, mixture of chronic inflammatory cells, polymorphonuclear leukocyte, and cellular debris, and also the fibrin. So, which is not a feature of the granuloma? So, first of all, we have to know the granuloma. The granuloma is usually developed from a chronic inflammation. It is developed from the chronic inflammation. So what happens when an organism, imagine this is an organism and this organism attacks one of the cell. So what happen, the natural defense system in our body, it encircles this organism, and when they can kill the organism in this condition, the acute inflammation occurs, and finally when the organism is removed, then acute inflammation stopped. But when our body system cannot destroy this organism, so what happened, the body system, it causes pact of the organism by different layer of the cell, and which is known as the granuloma. So granuloma, it is a feature from the chronic inflammation. So we have to find out the characteristics of chronic inflammation, and which is not a characteristics of chronic inflammation, that means the granuloma. So let's see the chronic inflammation. This is the chronic inflammation. So in case of the chronic inflammation, there is the angiogenesis predominant. That means there is the formation of the new blood vessel. Formation of the new blood vessel. Also, they are found macrophage, plasma cell, and lymphocyte, which is the macrophage, plasma cell, or lymphocyte, which is in short MPL, and it is healing by the fibrosis. So it is the chronic inflammation. And here we can see a granuloma. In case of the granuloma, here we can see the different layer present in this inside. Here we can see this is the Langerhans giant cells. That means the giant cells. The giant cell, actually they are the modified form of the macrophage. Also here we can see the cluster of the epithelioid cell and lymphocyte, and these epithelioid cell, they are also the modified form of the macrophage. And here we can see the elongated nuclei with epithelioid cell. Also here we can see the eosinophilic present. So these are the feature of a granuloma. And here also we can see the granuloma of the tuberculosis, and here we can see the caseous necrosis present. There is the epithelioid cell, there is the Langerhans giant cells, and also there are present the macrophage, there are present the lymphocyte, and there are present the plasma cell. So they are the feature of the chronic inflammatory cell or granuloma. So which is not a characters? Here first of all, the macrophage present. Macrophage, that means all form of macrophage present in case of the chronic inflammation. And also there is the epithelioid cell, there is the modified form of the macrophage. Also there is a mixture of the chronic inflammatory cells. What is the mixture of chronic inflammatory cell? Also macrophage, lymphocyte, plasma cell. Also there is altered macrophage, fused macrophage, epithelioid cell. So they are the chronic inflammatory cell. And here we can see the polymorphonuclear leukocyte, which is the neutrophil. In case of the chronic inflammation, neutrophil usually absent. That means neutrophil has no role in case of the chronic inflammatory area. That means when there is granuloma. So this option is false, which is the polymorphonuclear leukocyte.